My name is Marcel, and this is my wife Rita Ducharme, and we're both from Rhode Island, the smallest state in the Union. We're both nurses. I work as a psych nurse,
and I've worked for my way through nursing. I've done med-surg and orthopedics. I've done ER nursing, case management, and I currently do clinical appeals. We've heard about Wildwood for a number of years through different people, through 3ADN. We know people who have gone to both Wildwood and Uchi Pines. When we did Your Best Pathway to Health, we were talking, I happened to be sitting next to a woman who had done medical missionary work, and she mentioned that she had done a program at Wildwood. So that started us getting interested in that.
We found out there was an online program through research that my wife did, talking to people and actually going online and finding the different opportunities that were out there. I decided to take this course because, as I mentioned earlier, I've been doing nursing for just about 15 years now, and the more I learn about the health ministries and the simple treatments and that can be done that are more helpful and less damaging, it makes me want to experience them and participate in them more, and be able to do them as opposed to the nursing that I'm doing now.
When I did case management and nursing, I got to deal with people, talking with them a lot more than the time that you normally have when you're a nurse. And it became very obvious that there were a whole bunch of people who really didn't know how to take care of themselves. And it kind of became obvious that the need is out there for people to learn. And if you can get them before they get to the point that they have to be hospitalized, you're really doing God's work. But it's so interesting, having gone through nursing, to then be going through physiology, going through nutrition from a different standpoint. So the focus being on health and prevention is very important to me.
When we finished the course, I teased my wife a little bit, and I told her that maybe we should get a bus and do medical missionary touring, doing the therapies and presentations. She's not on board with that yet, but initially I think we're going to bring it back to our home church and try and expand it out of there. And if not, if that doesn't move forward, we have our massage table at home, and we have plans to at least do hydrotherapy and massage therapy out of our home base.
For anyone who is thinking about taking the program, I would definitely say go for it. I work a full-time job, and sometimes I have to convince myself to do the classes. So it does take some perseverance, and it takes some dedication on your part, but I think what you get out of it is so worth it that it's worth going forward. And it's just putting yourself on a little bit of a schedule.
I would say, if you're thinking of anything that has to do with medical missionary or health message, that this would be a good course to start with.